Hi, welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. And with that, let's begin. Today, we're talking about fluconazole, or diflucan, one of the most widely used antifungals and a go-to treatment for Candida infections. I'm coloring the brand name a cream orange the way that Candida may appear when it grows on a culture plate. Fluconazole belongs to the azole antifungal group. To remember our brand name, we have our PharmaLink phrase. This is a quick memory hook that your brain can latch onto to remember this pairing more easily. You might not know that fluconazole is different from other azole antifungals because it's cleared primarily by the kidneys instead of the liver. This means that it has far fewer drug interactions than its classmates ketoconazole and voriconazole, which both rely heavily on liver metabolism. Drugs metabolized in the liver through CYP enzymes tend to have a lot more interactions because they compete or block the same enzymes. Because fluconazole doesn't depend on those as much, it has fewer CYP-related interactions as well. It still has important interactions to be aware of, but compared to the rest, it's much cleaner and easier to manage clinically. As mentioned, fluconazole treats various types of candidiasis as well as cryptococcal meningitis. It can also be used as prophylaxis for patients who are immunocompromised. To remember these more easily, think diflucan, the Cove's Conqueror. Fluconazole has great penetration into the cerebrospinal fluid. This makes it the drug of choice when Cryptococcus is isolated in cases of meningitis. With a half-life of 30 hours, another advantage of fluconazole is that it can treat infections like vaginal candidiasis with a single dose. For side effects, fluconazole can cause abdominal pain because it can irritate the lining of the stomach and the GI tract, especially as the medication is absorbed. This can occasionally lead to cramping and discomfort. As mentioned, fluconazole is primarily cleared by the kidneys with minor hepatic metabolism. Although typically rare, hepatotoxicity can happen as fluconazole is processed in the liver and can overstimulate liver enzymes or trigger inflammation. For general warnings outside hepatotoxicity, fluconazole can also cause QT prolongation. This is because it subtly blocks potassium channels involved in the heart's electrical cycle, which prolongs cardiac repolarization and lengthens the QT interval. This effect overall will increase the potential for dangerous arrhythmias. As mentioned, fluconazole is a CYP inhibitor. Although fewer interactions, it will still cause increases in drugs like warfarin, phenytoin, and cyclosporin. And that completes our review. See you next time.